Good morning. This is Dr. Alex Nataros. This is our third installation of the Facebook Live. And just give me a moment to get us all dialed up and going. So this is Facebook Live, Dr. Alex's Dr. Alex's office hours. And this is a chance for us to focus a little bit on cancer screening. So we'll just get everything set up. And so, so cancer screening is something that's really important in terms of, ongoing prevention of cancer. We're going to talk about the different types of cancer. We're going to talk about, one of the main features of how the top 5 cancers present. And we'll have a chance to have a discussion. So I'd really encourage you to think about any questions that you have regarding cancer, prevention, diagnosis, screening, treatment, prevention of after effects, dealing with side effects of cancer, dealing with side effects of treatment of cancer, and to put them in the comments below. So again, just for a background, this Dr. Alex's office hour is sort of inspired by when I was in university. We would have office hours with teaching assistants and professors in classes. And weekly they would give us an hour of their time, and that would be a chance to, frankly, shoot the shit and deal with questions on any number of different issues related to the topic they were teaching. And from my perspective, I'm a family doctor. I'm the medical director of the North Island Community Health Center in Port Hardy. And it's important for me to share the best lessons and best practices. I care for about 2,000 patients, and we've got a larger practice of about 4,000 or 5,000 patients, and learn a lot every day of seeing 40 or 50 patients a day and learning best practices, seeing what works, what doesn't work, and seeing how cancer presents and how we treat it and how we defeat it. And so those are all some of the lessons that I'm going to be bringing in today. And so that's, part of what we're bringing up. And, my background, I studied medicine at McGill University for 4 years. That was after an undergraduate degree at Simon Fraser University in chemistry for 4 years, and then did a 5-year residency in family medicine. So I've got 13 years of post-secondary education towards becoming a family doctor. And that helps guide my approach in terms of tackling science, tackling issues of relevance to the public health. I think one of the challenges is accessibility to a family doctor and accessibility to an oncologist, a cancer doctor. And these can be very overwhelming issues. They can be issues that get in the way of, us being able to address concerns, anxieties around cancer. And part of the goal of this office hour is to demystify and, break down some of the uncertainties around cancer screening, prevention, diagnosis, treatment, after effects, side effects, and just really, as much as anything, reassuring yourself, your loved ones, of, the issues at play. So without too much more to go in terms of introduction, I'd like to just introduce what are, the common cancers that we see and, how can we prevent them? That's, first and foremost. And then, heaven forbid, if you're diagnosed with cancer, how do we manage it and how do we treat it? And reminder, this is an office hour, so what that means is it runs off your questions. So please think about any questions you may have in terms of cancer or things that have affected your loved ones and put them in the chat below. You can just type down below in the chat and I'll see them and I'll bring them up. So in terms of what are the big 5, what are, the 5 most common causes of cancer deaths in Canada? So these are the things that really, we're paying attention to, because what's relevant is what's going to kill you. And so, when we look at what are the common causes of death in Canada, the lead cause is heart attack and stroke. Second cause is cancer. So cancer is right up there. About 1 in 3 people will die from cancer or complications of cancer. So in terms of the big 5 of, cancer deaths, the lead is lung cancer. That might be surprising to people. Smoking rates have gone down, which is important, but a certain number of lung cancers come up in people who've never smoked. So we'll talk about that. The second most common cause of cancer death is colorectal cancer. So this is affecting the large intestine, the colon, which is the site where the food that you've eaten gets dehydrated and then produces feces or poo. And the third most common and a pretty sneaky one, pretty scary one, is pancreatic cancer. The third most common type of cancer death in Canada is pancreatic cancer. The fourth most common cause of cancer death is breast cancer, but it's actually the most common cause of cancer, but people survive it, is breast cancer. So 1 in 8 women will be diagnosed with breast cancer in their lifetime. So that's a lot, right? So, it's relevant to all of us, if we identify as men, to the women in our lives, that, we have effective cancer screening, that we, get our mammograms, and we're going to talk about all of that. Finally, the fifth most common cancer is prostate cancer, and this obviously affects men and people born as men and male genders. So, the prostate we'll talk about is a gland that's right next to the bladder, so where the urine is stored, and it's involved with producing juices that are involved, in procreation, in ejaculate. Obviously it becomes less necessary with age, and it can lead to issues with prostate cancer and prostate trouble. So those are the big five. So lung cancer, colon cancer, pancreatic cancer, breast cancer, and prostate cancer. I will touch upon a few other cancers today that are common, not common causes of death, fortunately, because we have good detection, screening, treatment. But they're cancers that, come up and you hear lots about and you may have been affected by. And those are going to be cervical cancer and oral cancer, which I'll put together because they're predominantly caused by human papillomavirus, which is a vaccine-preventable illness. You can get the Gardasil vaccine, and it's standard for kids to get. Very important. This is something that we're starting to see, and this is one of the great innovations and real exciting things in the time after the COVID pandemic, where we have these new vaccines, mRNA vaccines. We're starting to see vaccines that can prevent cancer, and HPV vaccine can prevent oral cancers, penile cancers, cervical cancers, and others. And then we'll discuss skin cancer. So, skin cancer is very common. You might be looking at me, heaven forbid, hopefully I don't, but one of the spots on my face might be a skin cancer that's slow growing. So, skin cancers are common and commonly very treatable. I, every Friday, host a procedures clinic at the North Island Community Health Center, and that's where I do lumps and bumps. And it's one of the best parts of my week, and I get to cut off cancer, and that's pretty cool. So we'll talk about all those. So first of all, what is cancer? Cancer is irregular, unregulated cell growth. So, one of the misconceptions is that cancer is one diagnosis, is one problem, is one disease. Cancer is thousands of different diseases. It's as diverse as the number of mutations that can exist. But there's certain patterns of cancer and certain locations of cancer that look similar. And one of the really exciting things that's happened just, within my career as a family doctor is we're getting targeted cancer treatments. So no longer do you necessarily need to just focus on chemotherapy, which is a broad-based treatment that tries to get rid of all rapid growing cells. But we can have focused therapies that focus on the specific types of cells and mutations that occur with cancer. So great to see one of my patients putting a question up, how young should you be when you first get checked for breast cancer? We'll get into that in terms of screening. I'll just answer that now. Certainly at 50, and ideally starting in your 40s. Start with your first mammogram and get the mammogram every 2 years. And so in terms of, we'll talk about screening that way. So, but in terms of cancer prevention, we know that mutations in cells as they produce cause cancer. And so what is a mutation? It's something that causes a change in growth and what's called unregulated cell growth. And so unregulated cell growth involves, if you look at, for example, my face, inside of my cheek, you might notice you have skin that peels off the inside of your cheek if you play with it or chew on it. Much like a snake sheds its skin, we produce cells constantly in our body. What prevents cancer from forming is that the cells have a code for programmed cell death. So when they get old enough, the cells then die. And that turns over. And, much as birth is a part of life, so is death a part of life. And it's an elegant creation structure within our cellular systems that prevent us from growing tumors all over us and growing thick layers of skin and otherwise. And so what happens with cancer is we lose that ability to, program and regulate cell death. And so, in short, you get unregulated, uncontrolled explosion of cells, and they start to take over the rest of the body. They consume all the nutrients, they take over the blood, they move, they block blood vessels, they block airways, they block digestive tracts, they block, compress the brain, they cause all sorts of complications just because of unregulated cell growth. So in terms of prevention, well, how do we prevent cancer? We prevent mutations. And, what are things that cause mutations? Well, the leading contributor to all cancers is tobacco smoking, so smoking. And vaping, we don't have good data because it's pretty recent, but we know types of vaping are cancer causing. But specifically tobacco use, is a contributor to cancer and all types of cancer in terms of mutations. So the leading contributor to cancer is tobacco use. Second leading cause is alcohol use. Now, I enjoy a beer every now and then, enjoyed a beer at the end of my workday yesterday. Does that mean that we shouldn't drink at all? Well, like drinking in pregnancy, there's no safe amount. So we don't know how much you can drink and safely not cause cancer, much as we don't know how much you can safely smoke and not cause cancer, because it's a random event that causes mutations that lead to cancer. And so what's the third leading contributing cause that you can prevent in terms of cancer is, exposure to chemicals. And exposure to chemicals in the food supply, exposure to chemicals, pesticides and otherwise. Does that mean eating organic prevents cancer? Unfortunately, we don't have good evidence that that's the case. And there's different reasons for that, some of which I don't entirely understand. But, generally it's a good idea to reduce the consumption of synthetic produced chemicals. Additionally, cancer is often, and skin cancer specifically, but, other cancers can be caused by mutations caused by sun exposure. And so limiting sun exposure, wearing sun protection in terms of, UV protection clothes, hats, sunscreen, all very helpful. Now I want to talk a little bit about screening and cancer screening because, what's better than treating cancer is catching cancer before it even starts. And so, I think many of us can reflect on, the knowledge that a dose of prevention is worth more than a pound of cure. And so, that's something that I come back to frequently with patients is if we can do a little bit of work early on, then maybe we can prevent, problems down the road. So in terms of screening for cancer, I'm going to talk a little bit, we can start with the leading cause of cancer death, which is lung cancer. So screening for lung cancer, there's if you've smoked, you're a candidate for screening for lung cancer, and you have to have smoked a fair bit, like for 20 years, for you to be eligible for screening. And I'm going to refer to the BC screening guidelines. So, one of the things with this office hour, Dr. Alex's office hour, is I want to come back to what are tools that you can use where, yes, your one-on-one consultation with your family doctor and nurse practitioner is important, but I want to empower you to take steps to look after yourself and your family. Part of that is being, a good Dr. Google user. And, I've said before that, I've got colleagues that really sometimes get frustrated when patients come in and they've Googled all their symptoms and otherwise. I think it's fantastic. It's part of health literacy, and part of what my goal is with these Dr. Alex office hours is preventing, misinformation and helping us work through our work through things that we might stumble on in terms of how we care for ourselves and care for our loved ones. So for example, let's pull up Google. Let's do Google BC cancer screening. The first thing that'll come up is BC cancer screening, a webpage that says screening save lives. Fantastic source for cervical, colon, and breast and lung screening prevention. So I'm going to spend a little bit of time on this. I'm going to just pause there. We've got a great question, and again, encouraging everyone to put questions below in the chat, because that's how this discussion grows, evolves, and we learn from each other. Question from one of my patients: what about air pollution? Great question, and yeah, I missed that. Air pollution is a leading contributor cause of cancer and contributor to mutations that contribute to cancer. So we know that air pollution is a leading cause of COPD other than tobacco use, and that's emphysema, bronchitis, and is a leading contributor towards cancers that remain not very well understood. It's difficult to study air pollution and contribution towards mutations, because the mutations occur at a cellular level and lead to cancer many years later after the original exposure. But it's a good question. So going back to screening, let's start with lung screening. So lung screening, again, lung cancer being the #1 cause of cancer deaths. Like I said, don't smoke. But if you have smoked, and if you smoked for over 20 years, and again, looking at this BC cancer screening, we've got lung screening. They've got a great program. If you've smoked for over 20 years and you're between the ages of 50 and 74, you should get screened. We want to catch lung cancer before it gets bigger. We want to treat lung cancer before it spreads. We know we can save people from lung cancer if it's caught early. So if you know anyone who's smoked and is between the ages of 50 and 74, get them to get screened for lung cancer. What does that look like? So they should call a phone number. I'm going to give you the phone number now. 1-877-717-5864. And again, that number is 1-877-717-5864. That's a BC lung screening. And what that will do is connect you with a healthcare provider. They'll ask you a few questions that we've already discussed on our Facebook Live today about cigarette use, duration, and then you'll be set up for a CT scan of your chest. And this would do a series of CT scans of your chest, one and then one in another year, to compare for any changes. And that is accurate in terms of screening for lung cancer. And the best treatment is early detection. And so, maybe I'll just take a step back too in terms of screening, because this is something that we learn a lot about in medical school, and we deal with a lot every day in terms of, how do we catch disease before it's presented, in terms of symptoms, which is what you as a patient would experience, and signs, which is what we would see or be able to find on examination, but you might not notice. So in terms of screening, there's two, key things to keep in mind. We want to capture disease early and capture changes early. And so we need good tests to do that. And a good test is something that has what's called a low false positive rate and a low false negative rate. So let's just, work that through. So what is a false positive? That is where you falsely, incorrectly say something is cancer. Now, why is it good to have a low false positive rate? Well, because, for the example of lung cancer, if we do a scan of your chest and we see something and it's a spot, we don't know if it's cancer without taking a biopsy of it, a sample of it. But it might look a bit funky. And, if it looks funky, then I, as your family doctor, will give you a call and say, I looked over this scan and, it might be cancer. Now, what is the risk of that false positive? Just think of yourself being told by your doctor you might have cancer. That is something that is scary. It causes anxiety. It's going to ruin your day, ruin your week, maybe even ruin your year. And it's going to lead to a cascade of tests to determine if, in fact, what we saw, the spot on that scan, is cancer. And so we want to lower the false positive test rate with screening. The other concept that's really important is false negative rate. And this is actually the most important thing for screening to minimize, because a false negative is where you incorrectly, as your treating doctor, I tell you that you don't have cancer when you actually did have cancer. So these tests that we use for screening are designed to have a very low false negative rate. So they capture cancer accurately at an early stage. And the trade-off for that is sometimes they capture things that aren't cancer and they're oversensitive. And that means they have a higher false positive rate. So those are just some basic concepts in terms of screening that are important to keep in mind, right? And so, when you're told something was found on your cancer screening, that doesn't mean that you have cancer. That means that test, which has a higher false positive rate, is a door to opening for the further discussion around whether you need more investigations and what else we do. So we've talked a bit about lung cancer screening. Again, if you smoked over 20 years and you're between the ages of 50 and 74, you should get a scan, 2 scans of your chest to screen for cancer. Next screening I'd like to talk about is colorectal cancer screening. This is, a very common, second leading cause of cancer death and second leading overall cause of cancer. Affects about 1 in 13 people in terms of in their lifetimes. So, some of you may remember famous celebrities getting colonoscopies to try and raise awareness. And this is, something that's been done. Colonoscopy is one tool, but the leading tool that's used for screening for colon cancer is called a FIT test, fecal immunochemical test. You just remember FIT test, F-I-T. And so what that is a poo test, and you get a kit from the hospital, and you smear a little bit of poo, and we test it to see if there's any blood or any traces of digested blood. And so that can be very effective in terms of determining if there's something that we should look for. Again, this is something that has a high false positive rate, where it detects things that we say could be cancer but aren't necessarily cancer, that we have to check more frequently. So in terms of the colon screening, you should get screened if you're between the ages of 50 and 74, or 10 years earlier than a family relative, especially first-degree relative, if they were ever diagnosed with colon cancer. So this is important. You can get screened, talk to your family doctor. I'm going to talk briefly about what you do if you don't have a family doctor. But colon cancer screening is very effective because it identifies those who might have colon cancer with this FIT test, the stool test you can do in the comfort and security, privacy of your own home. And then if it is positive, heaven forbid, then we have a discussion as your family doctor, as the person screening you. We say, maybe you should have a colonoscopy, and that's where you get a little bit of medication so you're sleepy, and then you get a camera that goes up the bum, and that looks the length of your large intestine to see if there's any what are called polyps, which are growths. So you can think of them as like a warty growth on your skin that's inside your intestine. And so that can be a very effective way of catching cancers, and you can treat them. So you can screen them by doing a colonoscopy. You can visually spot them. You can do a biopsy of them, and this would typically be done by a general surgeon or a gastroenterologist, so both doctors. And then you can treat the polyps, these growths, before they turn into a cancer or a more aggressive cancer. Sometimes, it's seen during the colonoscopy that it's an aggressive cancer, and that's when you would need larger surgery. So, for example, perhaps removal of part of your colon, perhaps chemotherapy, perhaps radiation therapy as part of that. And those can occur before surgery, they can occur after surgery. That's part of the discussion with the oncologist, the cancer doctor, as well as the surgeon. So we've got a few good questions that have come up, so I'll just take a pause from going through screening. First one of my patients. Around air pollutants entering the food, for sure. There's various chemicals that occur in air pollution. If you live close to a mill or otherwise, often there's what's called organofluorocarbons, which are cancer-causing chemicals. And so when we look at, and industries have really tried to clean up, but we do know that industrial pollutants can contribute to cancer risk. And so, yes, they can enter the food supply from landing on food. Again, mutations occur very frequently. Our bodies are very good at capturing and preventing mutations from turning into or growing as cancer, typically. Sometimes mutations cause those proofreading functions to be turned off. And so that's where we need to do our own work in terms of cancer screening and detection. We've got another question, a great question from an old high school mate. Can you speak to heavy metal toxicity and parasites? There's a lot of talk online about doing heavy metal and parasite detox cleanses. Is this a real concern? Really good question. Something I come across a lot. So I have a number of patients that come in and say they've done this cleanse or that cleanse. Big picture is that there's no cleanse that's really effective in terms of cleaning heavy metals from your body. We require various minerals, which are heavy metals, to function. Our bodies use them as catalysts in our cells. So they play a role. There's a lot of misinformation online in terms of cleanses. What I'd say in terms of misinformation, and part of the role of this office hour is to push back on misinformation, always look at who's profiting and who can benefit from a cleanse, who's selling the product, who's promoting it, who's making money off advertising. But no, there's no role for heavy duty or heavy metal cleanses. There's no role for parasite cleanses. Parasites are very easily treated. We have to detect them by doing a poo test, and then we can easily treat them with 1 to 2 days of an oral medication that's otherwise very safe. So again, in response to the question, not a concern. Reminder as we go, this is Facebook Office Hour. Put your questions in the chat below. It's meant to be interactive, really helpful to have your feedback. So continuing on with our cancer screening, we've done lung cancer, the leading cause of cancer death. We've done colon cancer, the second leading cause of cancer death. Now we'll go on to breast cancer, the fourth leading cause of cancer death. So, this is common. 1 in 8 women will have breast cancer in their lifetimes. Very important to get screened. Screening saves lives. And so this is where mammography, like I mentioned earlier, between the ages of 50 and 74 or older, if you're, otherwise very healthy, is important. And getting a mammogram every 2 years, unless if you're higher risk. And so if you are higher risk, if you've had a first-degree relative or a strong family history of breast cancer, maybe you start getting your mammograms in your 40s, even possibly 30s. I generally advise most women to start getting their mammograms in their 40s. Perhaps you've been told that you have dense breasts, and there isn't a real easy way, certainly not on exam, to detect dense breasts. It's a diagnosis that we make with mammograms, which is an x-ray of the compressed breast. But if you have dense breasts, it means that you need to have earlier mammograms and ultrasounds to detect breast cancer, because it can be harder to detect. And so in terms of breast cancer, like I say, mammograms every 2 years from 50 to 74, really ideally starting in the 40s. For everyone living in BC, there's BC Cancer Screening, is very effective. I'm going to give you a phone number now for mammogram screening, mammography. You can call the phone number 1-800-663-9203 to figure out where and how to get your mammogram. Or for your loved ones, again, that number is 1-800-663-9203. And so, again, mammograms are effective. the biggest risk of a mammogram is what I described earlier, which is the false positive rate and the anxiety that can cause. You are told that something was seen on your mammogram. It's a spot. We commonly see spots on breast mammograms. Usually they aren't cancer. So that leads to a bit of anxiety. We have to do a biopsy, and there's waiting and otherwise. I've got another great question. Can you speak to the benefits of fasting? Are there health benefits? Does this promote autophagy or other repairs to body or gut health? So, to the big picture today of cancer screening prevention, this does play into that, because one of the contributing factors of cancer is obesity. And so, and diabetes contributes too. So, if you want good diabetes control, you want to minimize your excess weight. And so we've got a question here in terms of the benefits of fasting. Now, the data is a little mixed on fasting. What I've seen that suggests there's some benefit is for people that are struggling with obesity, that are struggling with diabetes. So, this isn't for everyone. But intermittent fasting, which is to say 12 to 16 hours. So, for example, you finish dinner at 6 p.m., you have breakfast at 8 a.m. or 10 a.m. That is an example of intermittent fasting. That can lead to increased insulin sensitivity. It can lead to weight loss. There's really good sources. Diet Doctor online goes over the evidence. And there's a great book for if you have diabetes by Dr. Jason Fung called The Diabetes Code. And so great source of discussion in terms of intermittent fasting. So that might answer some of your questions, but certainly there are health benefits to intermittent fasting. As much as anything, you eat less typically when you fast. And so the overall calories in the day are less, which is a good thing, right? So we'll keep going. Love your questions. Please bring up the questions as we go. This is an interactive Dr. Alex Facebook Live office hour. And so I want to know what it is that's impacting you, your family, and the public health, and how we push back on misinformation, how we help you use Dr. Google, and how we help you be an informed healthcare consumer and be an effective patient with your providers. So next, cancer screening is prostate screening. So prostate screening this is again for men. I recommend for all men, and I'm guided by my urology colleagues. All men about the age of 50 should have a finger up the bum, so a prostate exam, and as well as a prostate serum-specific antigen, which is a PSA blood test. Now, this can start earlier if there's a strong family history, so maybe even in the 40s. If you've got family history, or if you're Black or of Caribbean descent, that makes you higher risk. Prostate cancer, the big challenge is detecting the tortoise versus the hare. And what that means is there's a lot of prostate cancer that's quite slow growing. More men die with prostate cancer than because of prostate cancer. So obviously we don't want to cause anxiety, we don't want to cause stress trying to treat and side effects of treating a cancer that's going to not impact you. We want to capture the hares, right? We want to capture the fast-moving cancers that are aggressive. And so that's where part of early screening and discussions can help. We've got another great question in terms of, fasting 24 to 48 hours. I'm not aware of any good evidence that long-term fasting is beneficial for health. Again, if you look at overall, if you're fasting for 24 to 48 hours, you're consuming a lot less calories. If you're struggling with weight, less calories in will lead to weight loss, and that's a good thing. But specifically long-term fasts, there's a lot of misinformation online. I'd really encourage you to be careful in what you proceed with in terms of fasting and cleanses. And as I say, there's no good medical evidence that long-term fasts, 24 to 48 hours, are of any physical benefit other than consuming less calories. Now, in terms of mental benefit, when I was in high school, I organized a fast, 24-hour fast for a good cause. There's real mental benefits and psychological benefits to solidarity, working together, and fasting. So going back to cancer screening, next we've got cervical cancer screening. So, this is a very common cancer in young women. Fortunately, much less common than it used to be because we have the human papillomavirus, HPV immunization, vaccination. And this is something that all men and women should get if they're younger, certainly in schools. Very important, prevents oral cancer, prevents penile cancer, prevents cervical cancer. But in terms of cervical cancer screening, hey, who hasn't heard of Pap tests, right? And there's probably very few women out there that haven't had discomfort and don't dread going into their doctor or their nurse practitioner for a Pap test. And so we very fortunately in BC have a new system where you can do your own cervical cancer screening by screening for HPV, the human papillomavirus, by putting a swab in the vagina and sending that off. And so like doing the FIT test for colon cancer, you can do the HPV cervical cancer screening in the comfort of your own home. So cervical cancer screening, very important. Get a Pap test if you need it from your family doctor, or even better, get a kit to use at home. For those that are under the age of 70, women, or over the age of 25, so between 25 and 70, you need to get screened for cervical cancer. Unless if you've had surgery where you've had your uterus and cervix removed, as long as you haven't had previous cervical cancer. So if you need to get a cervical cancer screening kit, I'm going to give you a phone number or pass on to your loved ones. Phone number is 1-877-702-6566. This will connect you with a nurse who will arrange for you to get a kit, and you get that kit done in the comfort of your own home for cervical cancer screening. And so again, that number is 1-877-702-6566 for cervical cancer screening. Now, in terms of other cancers, much less common than the big five that I mentioned, oral cancer is something that your dentist commonly looks for. If you've got a non-healing lesion or ulcer in your mouth, it's important for that to get checked out by your doctor. And then skin cancer. And so skin cancer, certainly if you're lighter skinned, if you have orange hair, if you have a lot of freckles, this is something you have to pay close attention to. And so seeing your doctor, looking for what are called the ABCDEs of skin cancer screening. And so I'll go through those. You can Google ABCDEs, skin cancer screening. It goes through. But first of all, A is for asymmetry. So if you've got a funny looking spot that may have maybe a jagged edge. B is for border irregularities. So similarly, if it's not an even edge, if you have something uneven, or if there's asymmetry, one side looks different from the other in a skin spot. C is color, if you've got multiple colors, 2 or 3 different colors in a skin spot. And D is diameter, more than about a centimeter, maybe a little bit less, 6 to 10 millimeters, something that's bigger. Again, these rules don't mean it's cancer, but they mean you should have someone have a look at it and maybe get a biopsy. And so next is evolution. And really ABCDE, evolution is the most important. That's how it's changing. So if your loved one has a skin spot that you're concerned about, the best thing you can do is get your friendly, trusty camera, take a picture of it, compare it in 2 weeks, show those pictures to your doctor, and that's a good opportunity to see, is it changing? Cancer changes, cancer grows, cancer mutates. So, detecting cancer means watching for changes. We've got another great question up here. Would love to hear your take on gut health and pre-probiotics. My family doctor seems to recommend them for immune function, overall health, but I've heard other doctors saying they are not much benefit and don't last in the gut. Good question. I'm not an expert in pre and probiotics. I take my lead from talking to my gastroenterology friends and colleagues. I read a study today that was a good review in terms of the impact of prebiotics for urinary tract infections. So you can insert prebiotics, lactobacillus, into the vagina, and that decreases quite significantly the rate of urinary tract infections. We're learning a lot about this. It's still early days in terms of pre and probiotics. I think there's no harm if you're otherwise healthy and not immunocompromised and not on chemotherapy. No harm in taking pre and probiotics. There might be benefit, and there might be benefit if you have, gut changes, if you have irritable bowel syndrome, if you've taken a bunch of antibiotics recently for, say, a respiratory infection, that might be of help. So, so is it true that they don't last in the gut? Well, there's more bacteria in the gut than there are cells in the body. So there's so many bacteria that, yes, they get consumed, and that, yes, they're fuel for the bacteria. So they don't last in the gut, but that's natural. And that's, the process of the gut environment. So great question there. I really encourage everyone. We've got about 15 more minutes in this Facebook Live. Put up your questions. They can be general medical questions. They can be questions that relate to something that you or a loved one is experiencing without identifying yourself. Or if we want to focus on cancer, I'll keep going in terms of cancer screening, prevention, treatment. So we've gone through screening for cancer. Now I'll go through, diagnosis. Diagnosis is part of the screening, so we've talked a bit about this. But in terms of lung cancer, the most common cause of cancer deaths in Canada, colon cancer, the second most common cause, pancreatic cancer, the third most common cause of cancer deaths in Canada, breast cancer, the fourth, and prostate cancer, the fifth. One that I haven't talked too much about today in terms of screening and diagnosis is pancreatic cancer. This is a scary cancer because it commonly presents quite late. What that means is it doesn't have the signs and symptoms. We don't see or experience it as a cancer in the body until sometimes it's already quite aggressive and quite far along. And so pancreatic cancer, the pancreas is a gland in the body in the upper abdomen, and it goes across your upper abdomen, and it produces enzymes. It produces chemicals in the body that help digest foods. It produces insulin, which you need to regulate your blood sugar supply. It produces other hormones that are effective in the body. And so it's a very important organ, but it, like all tissue in the body, can have mutations, and that can lead to cancer. And so pancreatic cancer commonly presents in terms of symptoms that you have, that you're quite readily full, that you feel a lot of bloating, that you may have jaundice as a sign, which is you have yellow in your eyes, that you have abdominal pain. Again, there's lots of people I see every day that have abdominal pain, bloating, feel full easily, that don't have pancreatic cancer. The far, far, far majority don't have pancreatic cancer. So if you're listening today and thinking, oh no, the doctor said if I have abdominal bloating, I have pancreatic cancer, that is not what I'm saying. That's a symptom that you're having that you should probably discuss with your doctor. There's a few red flags, scary symptoms that may make cancer, and specifically pancreatic cancer, more likely, and that's weight loss with abdominal bloating. And so, that's all part of the importance of getting checked. And a family doctor can check in terms of your abdomen, and then we can do a screening like doing an MRI or a CAT scan of your abdomen. We can do some blood tests that can help. But pancreatic cancer, it's a scary one. And, I've lost a number of patients to pancreatic cancer. I've treated many patients over the years for pancreatic cancer. I've lost loved ones to it as well. So, let's talk a little bit about treatment, because treatments... Oh, we've got another question up here. Will you have another Dr. Alex office hour? Yeah, we're going to continue doing this every 2 to 3 weeks. So if you don't already, make sure you like my Facebook page, which is Alex Nataros MD. I'll make sure I put an event in the page. So in terms of cancer treatments, we've come so far with cancer treatment. It's incredible to see the advances we've made. And I've talked about this a bit earlier today in terms of cancer as mutations to cells. And so cancer is not one diagnosis. Cancer is thousands of different diagnoses. And preventing and treating cancer involves recognizing the unique aspect of different types of cancer. And so in terms of, cancer treatment, one of the exciting things is we've gone from, in the 1950s, 60s, 70s, where chemotherapy was very early, and we would basically treat the human body with a nuclear bomb that would wipe out all fast-growing cells. That's why you lose hair, because that's a fast-growing cell. Your blood counts go down because that's a fast-growing cell. Your lips start to peel. You have teary eyes. All the fast-growing cells, you have diarrhea. Fast-growing cells in the body are affected by chemotherapy. Now, we've come so far in terms of chemotherapy. We still use it. Chemo means chemical. Therapy means treatment. Chemical treatment targeting the body and targeting the cells in the body. It's essentially a race. It's a race to kill all the cancer cells while keeping the good cells alive. And it's not easy. That's why you get side effects and you get, negative effects to having chemotherapy. We've managed to really refine and improve our chemotherapy so it's more targeted, it's less likely to cause the side effects, and we can use smaller doses of it. And how we do that is we combine it with different treatments. We combine it with doing surgery. We combine it with doing radiation therapy. We combine it with doing immunotherapy. And the immunotherapy is the newest treatment. So I will talk a bit about that, but I'll mention radiation therapy because that's the next oldest treatment for cancer. That's where we use radiation, which is high energy rays, basically, that we shoot at the cancer. And so you can think of like sunlight or a laser being a ray, high energy rays that we shoot at a cancer, and it essentially destroys the cancer tissue. And again, this technology has gotten so much better where we can focus and we can protect cells that we want not to get harmed and only treat the cancer cells. And sometimes this involves, like for prostate cancer, injecting little pellets of radioactive material into the prostate and they burn away the bad cells. Or it involves going inside, say, a treatment tube and having the radiation put on the beam put on the cancer in the body, maybe in the brain. They call that stereotactic radiosurgery. So it's targeted surgery without going into the skull, into the brain, where you get treated for cancer. What are the side effects? That's a big thing. Is anytime after you've had tissue damage, you can think of twisting your ankle or hurting yourself. There's inflammation, there's redness, there's swelling. So when we try and destroy some of the tissue with radiation therapy, it can lead to swelling, it can lead to nausea, it can lead to vomiting, diarrhea, all these side effects. And so that's part of our work as doctors that treat cancer, is dealing with the side effects. And we probably won't have time to get completely into the side effects today, but that's part of it. Now, the next in terms of treatment for cancer, like I've talked about, is immunotherapy. Now, this is the most exciting part of cancer treatment right now because we've come so far in terms of cancer treatments. And so this is where we target the specific genetics of the cancer. So it recognizes that cancer has thousands of different diagnoses, and your cancer is unique to you, unique to the mutation that occurred. And so it's creating a special medicine that targets. So rather than chemotherapy, where it's like a nuclear bomb that targets all the cells, this is focused. And it's led to, for example, melanoma, skin cancers, which are aggressive skin cancers. It's led to us being able to take a skin cancer that has spread in the body and reverse it and treat it effectively. So it's, frankly, modern medicine and science has completely transformed how we deliver cancer care because it's less impactful, less side effects, it's more effective, and lasts longer, you survive longer. So melanoma, even stage 4, spread throughout the body, depending on the specific type of melanoma skin cancer, can be treatable. We'll take a pause and look. We've got a great question in the comments. Not specific to cancer, but a general medical question, which I really appreciate seeing. ADHD and autism and connective tissue disorders. Such a strong connection, but doctors seem not to screen for this. Yeah, so we've talked a bit about screening for cancer today, but screening for other medical conditions like ADHD and autism and connective tissue disorders, we do screen for those, and there's different ways you screen. You screen by doing a behavioral assessment. So, every child that I see in my clinic, I screen them for ADHD and autism. Doing a full diagnosis takes more effort and is often a doctor and a psychologist and otherwise, but screening is common. Connective tissue disorders, I'll often do a musculoskeletal exam, assess a person's gait, their joint mobility. And so, in terms of the question that's asked, I'm not entirely clear what the questioner is asking in terms of ADHD and autism and connective tissue disorders. I'm not aware of a link between ADHD and autism in terms of one causes the other. There's overlap, so there's patients I see who have autism spectrum disorder and they also have ADHD, or vice versa. Or there's patients that have connective tissue disorders that also have autism or also have ADHD, but I'm not aware of a cause between the two. So keep putting your questions in the chat. We've got just over 5 minutes left in this Facebook Live. Love to hear your thoughts, general medical questions, or specific to our cancer topic today. Would be greatly appreciated. Next thing that I want to talk about is, we've gone through cancer prevention, we've gone through cancer screening, we've gone through cancer diagnosis, we've gone through a few different cancer treatments, and then follow-up. And so, you or your loved ones might know someone living with cancer. This has become so much more common because we're so much more effective at treating cancer now than we used to be. Cancer, as I've said, it's thousands of different diagnoses, thousands of different problems, but as a class of medical disease, cancer is much more treatable than it used to be. We've made huge strides in treating cancer. What that means is you're more likely to, survive cancer than you are to die of cancer generally, which is tremendous, right? It depends on the type of cancer and how late it was diagnosed, but so what that means is we have a lot of cancer survivors. And, I used to look after a number of people that were dragon boaters on a breast cancer dragon boat survival team in the Comox Valley. And so, there's lots of examples of this, of cancer survivors and dealing with the side effects of some of the treatments or some of the, surgery or otherwise, have common, experiences. And psychologically, right? Being diagnosed with cancer is scary, right? It brings with it a realization of your own mortality, that you might die, that you might, be lost to your loved ones. And so, cancer survivorship is a big, new, and exciting field. I work with lots of survivors of cancer, 5, 10, 15, 20, even 30 or 40 years down the road for survivors of childhood cancer. And so that's really exciting in terms of, we can turn cancer from a terminal condition where you die from it to something that you can survive and even thrive with. And so part of our goal is to help people function and thrive in a post-cancer world. And so, that means in making sure that we're addressing risk factors for other cancers, or for heart disease, or for diabetes, or for weight gain. So that's really all part of that picture. One thing that I haven't touched upon is, diagnosis of cancer stages. So, there's such thing as, metastatic cancer. You might have heard of stage 4 cancer. That sounds scary. It is scary. It means that the cancer has spread outside of its bubble in the body to other parts of the body and may be growing. So, for example, colon cancer may have spread to the liver, and you might have spots of cancer in your liver. Or breast cancer might have spread to your spine or to your brain. Now, this makes it less likely that you will survive in the long term, but there are increasingly, every year we have more treatments for stage 4 cancer, like I mentioned, for melanoma. So we're just into our last few minutes. Please, any last questions, put them in the chat. It's been great to have this discussion in terms of cancer prevention, screening, diagnosis, treatment, and follow-up. If you're just joining now, this is recorded live, but you can watch and scan through. I think we've done a really good review And I'm proud of what we've done, sharing my experience as a family doctor at the North Island Community Health Centre in Port Hardy. And I wish everyone a great rest of the day, good weekend to come. And otherwise, watch for the next Dr. Alex office hour. Oh, we've got a question that's just come in. What about microplastics? Are they a concern building up in the body? This comes back to the question of cancer-causing chemicals. Microplastics are not necessarily cancer-causing, but there are some that do. This is a very good question, and I'd encourage you to check out the Canadian Association of Physicians for the Environment, CAPE. They do a lot of good work around environmental determinants and causes of cancer. And yes, microplastics are a concern. We don't quite understand how they contribute to cancer. We don't quite understand how they contribute to other illnesses, but we need to do better keeping microplastics out of our bodies. So I guess we'll leave it at that. We're coming around to the top of the hour, and it's been great to join all of you today. Please spread the word, encourage people to like my Facebook page, Alex Nataros MD, and we'll have a chance to do this again. Okay, bye for now.